Hello and welcome to another edition of Stuff You Should Know About Durham Region. I'm your host, Gary Williams, Director of Corporate Communications here at the Region. Today I'm joined by Dr. Robert Kyle, Medical Officer of Health here at the Region, to talk to us about the current state of COVID-19 in Durham. Welcome, Dr. Kyle.
Good morning, Gary. Great to be here.
Yes, thanks for joining us. So I'm going to get right into it. And we've heard a lot from the Premier and other health officials that we're in the second wave of COVID-19 and we're seeing the numbers of positive cases rising. What's your message to Durham Region folks at this time?
Yeah, so that's what's happening in Durham Region. If we compare the first wave to the second wave, which we've been in for a few weeks, in my judgment anyway, we're seeing similar numbers of cases reported to us on a daily basis. We're seeing far more contacts per case, which is unlike the first wave, which was driven largely by travel and then outbreaks in long-term care homes. It makes sense because the economy is more open than it was in the springtime. So businesses are open, services are open, and of course, schools, childcare centers, and so forth are open as well. So the numbers are increased. We're seeing outbreaks in childcare centers, schools. We're seeing cases in schools and post-secondary institutions, congregate living centers like group homes and shelters, and long-term care homes and retirement homes. So it's a mixed bag, steady increased number of cases. So that's the current status in Durham Region at this time.
Thanks for that. So, COVID has changed our lives, as we know. We just went through Thanksgiving, and that's been a change for people not getting, with family in big groups. We're getting really close to some big events and holidays, such as Halloween and Remembrance Day. So let's start with Halloween, talk a little bit about that. What's your recommendations when it comes to celebrating Halloween safely this year?
Yeah, so first of all, you can get messages and information about this on our website, durham.ca/novel coronavirus. I think it's safe to say we view Halloween, particularly for adults, to be similar to other social gatherings like Thanksgiving. So if you're contemplating a party with many people attending, don't do it. Restrict who you're partying with to those who live in your immediate household. Secondly, I think it's fair to say that going door to door may not be considered essential, but if in fact Halloween trick-or-treating is part of your customs and traditions, you can do it safely. And you do that by adhering to the basic messages that we've been repeating over and over again with respect to COVID-19. So respect physical distancing, respect gathering limits, largely not a problem with trick-or-treating unless you have kind of a large neighborhood kind of crowd go door to door. So, be respectful of that. Bear in mind that a Halloween mask is not going to protect others from you if you're a shedder, so you need to wear a mask. You should practice physical distancing if you arrive at a home at the same time as others. So take your time. Let others go ahead before you, and then let them retreat, and then you go forward. Of course, certainly before you go and when you get home, wash your hands, practice respiratory etiquette, and I think you can do it safely. But if you have any concerns about trick-or-treating, if you don't consider it essential, if you think the risk is too high, then by all means, stick with your own risk assessment and be cautious. But certainly with respect to parties, Halloween mask, costume parties, and so forth, not a good idea in the second wave, and I would certainly discourage that type of behavior. We do have, as I said, Halloween, Remembrance Day, social gathering messaging on our website, and I would urge listeners to go to durham.ca/novel coronavirus.
Great, thanks for that. Next question I have for you. So we've seen some hotspots like Peel Region, Toronto returning to stage 2. Do you think Durham will be entering into stage 2 anytime soon? What's your thought on that? And can you even predict that?
So one, I can't predict that, but what I can tell you is I think the province who would make that call is keeping a close eye on our numbers. In terms of the metrics they use to decide whether an area needs to go into stage 2 or not, I'm not on the inside, but I do think they are looking at, in particular, sustained increased number of cases per population. And certainly for the last few weeks, we've gone from single to low tens of cases per day to 20, 30. I think we had something like 40 this week. So certainly the numbers have increased. But I don't think it's our call. I do have certain legal tools. So if in fact there were problem areas not covered by provincial legislation and there was a legal remedy that we could use, I'd certainly entertain that. But I think in terms of extending the hot zones and the modified stage 2 to other areas, that really is the province's call. I think the key driver of that is, of course, population density. And of course, York Region, Durham, Halton, GTHA, we're kind of all in that belt. And I'm sure that the province is keeping a close eye on our numbers, but I don't have any particular knowledge in this regard.
Switch gears for a second, talk a little bit and focus on masks. So in a nutshell, why are masks so important?
So masks are part of a layered approach, if you will, to prevent COVID-19. So key is hand and respiratory hygiene, physical distancing, social distancing, and respecting gathering limits, particularly indoors. And masking is another tool to help prevent the spread of COVID-19. What it does is, if you're a carrier, if you will, of COVID-19, and you say and say you have no symptoms, then it protects others by virtue of preventing infected respiratory droplets leaving your mouth and contaminating your hand surfaces and that sort of thing. And I believe there is emerging evidence that at a population-wide level, the use of masks have a potential for reducing the spread. So it's not the be-all or end-all. It's one of several techniques that need to be considered to prevent the spread of COVID-19.
And what is the correct way to wear a mask? I know that's a simple question, but you do see people wearing it differently. What is the correct way? And do you have any tips on choosing a mask?
So for the general public, and in particular, we're talking about indoor public places where physical distancing is a challenge. In order for a mask to be effective, it needs to be double layered. It needs to be kind of bound either behind your head or around your ears. It needs to cover your nose and your mask. It needs to be snug fitting. And if it's reused, say it's a cloth mask, it needs to be durable and it needs to be form-fitting after it is washed. If you are a shedder, of course, you're contaminating the inside of the mask. So you need to handle it properly. So wash your hands before you use it. Don't touch the mask. Take it off by taking off your ear straps or your head straps. Dispose of it carefully and wash your hands afterwards. And I'm going to sound like a broken record, but if you need more information about how to properly wear a mask, how to make a mask, then go to durham.ca/novel coronavirus, and we have information that fills in some of the blanks that I've been unable to express up to now.
Sorry, one other question I had. How often should you wash your mask? Should you, as soon as you wear it one time outside, come back, and should we wash it again, or can you wear it a few times? What's the protocol on that?
Well, I think it differs. I would certainly, if you're using a cloth mask, I would certainly wash it on a daily basis. Do you need to do it more often during the daytime? Well, I think it depends on what you're doing, how, I guess, dirty it's getting. If you maybe don't have COVID-19, but you're coming down or feeling ill, and it, truly could be coming contaminated, you may want to consider that. If you take a break at lunchtime and you have a supply of masks, then that may make sense as well. But at a minimum, I certainly wouldn't reuse them more than daily, particularly if it's a cloth mask. You have a supply, you can wash it, that sort of thing. I don't think there's a magic kind of frequency with which you should use them. Do whatever makes sense, bearing in mind that in the activities that you're doing, you're contaminating the mask. And the more vigorous those activities, the more likely it is that they'll get soiled or dirty or that sort of thing. So use your common sense.
And one last question. When we talk about masks, you mentioned that masks are just one of the tools to fight against COVID-19. Can you take us through some of the other important public health practices that you recommend as we go through this pandemic?
The magic number is 6 feet or 2 meters in terms of physical distancing, so we need to respect that. There are indoor gathering limits that we need to adhere to, particularly with respect to indoor settings, and particularly given the weather is getting colder. And in those places that are in the hot zone, the limits are more strict than they are outside of the hot zones. Hand hygiene, I can't repeat that enough. Wash your hands with soap and water. Use a hand sanitizer if that is not possible. For respiratory symptoms, you've got a cough or a sneeze, use a Kleenex, dispose of the Kleenex carefully, and then wash your hands with soap and water. And if you don't have any available, use a hand sanitizer. We've just talked about the use of face coverings or non-medical masks if you're in indoor public places in particular, and where you're required to wear those masks. And if you're in an occupation where there is a higher risk of acquiring COVID-19 from the persons that you're serving to, and I'm thinking about healthcare workers, for example, then wear personal protective equipment, which have a higher level of standard and more types of layers of protection. So masks, gloves, gowns, face shield, that sort of thing. And most healthcare settings have set standards that you have to adhere to. And of course, in the region where we do provide clinical services, our healthcare workers would be expected to adhere to those, and we would facilitate the access of appropriate PPE. So it's a layered approach. It's fairly simple, and if you adhere to those techniques, then you're doing your part to protect others and to reduce the spread of COVID-19. And it's important to remain vigilant. I know that people are getting tired of the pandemic. I don't think it's going away anytime soon. And we're social creatures, so I get that we need to, or at least we have a desire to meet others and so forth, but we can do that safely. We have to continue to be vigilant, and we'll get through this. And as I said to other audiences, and I'll say it here, COVID-19 is a marathon. It's not a sprint. There are no easy fixes, and we just have to remain vigilant and do our part to protect others, to protect ourselves, and to slow, if not stop, the spread of COVID-19.
Excellent. And the information we found on the website, which is, again, Dr. Kyle?
Yes, durham.ca/novel coronavirus. And if you're interested in the numbers, we have a fabulous data tracker, and you can get that at durham.ca/COVID cases. So yeah, it's all there at your fingertips.
Excellent. Well, I want to thank you for your time today. I want to thank you and your team. I know it's been incredibly busy and you guys are working, 24/7, and it's been amazing, all the information you've been providing our residents and helping us keep safe. So thank you again. Thank you to your team, and we'll definitely have you back to keep us updated on what's going on in Durham.
Yes. Yeah, so thank you for your kind remarks, and I echo your sentiments about my team. They're fabulous. They've been working flat out. I think they've been providing excellent customer service. And of course, as mistakes happen or as people get impatient or what have you, they're top-notch professionals, and they work through those issues and do a tremendous job day in, day out. So I can't thank them enough for the service they've been providing to the community up to now, and will continue to do so in the weeks, months, and years ahead.
Absolutely. Thanks for your time, Dr. Kyle.
Thank you very much. Have a great day.
You too.